When a child develops the characteristic jaw swelling of mumps, the household atmosphere shifts immediately to high stress. Caregivers are suddenly faced with a visible, painful infection, and the instinct is to search for a way to stop the hurting. You cannot cure the virus, but you can control the experience. By following a structured 5-day protocol, you can systematically eliminate preventable pain and navigate the entire viral cycle right from home. To execute this plan, you need to gather 3 specific tools right now. First, get your child on a scale to find their exact current weight. Second, secure liquid over-the-counter pain relievers. And third, have a precise oral dosing syringe ready. The core strategy here is defensive. We are not trying to attack the mumps virus itself. Instead, we are executing a tightly controlled step-by-step protocol to suppress the symptoms while the immune system does the heavy lifting. This 5-day management timeline maps out the next week. Step 1 is establishing a strict quarantine, represented by the solid blue isolation bar. The clock starts the moment jaw swelling appears. Maintain this quarantine precisely until day 5, as the virus is highly contagious. Looking at the social and environmental row of this protocol, the rules are clear. The child must be kept in an isolated resting environment at home. Exposure to high-traffic areas like schools is strictly prohibited to prevent an outbreak. Once the environment is secure, the immediate focus shifts to pharmacological support to suppress the active fever and severe jaw ache. This schedule details the dosing strategy. Use a combination syrup of paracetamol and ibuprofen, given TDS 3 times a day, to target pain and fever. Calculate these doses strictly by the patient's current weight to ensure accurate symptom relief without risking an overdose. Caregivers often instinctively request antibiotics, but this graphic illustrates a critical medical reality. The mumps viral structure naturally deflects them. Antibiotics cannot kill a virus. They are useless here, so treatment must focus strictly on symptomatic relief, not antibacterial eradication. Successful medical management of mumps requires strict discipline. Administer targeted, weight-based pain relief, and absolutely reject the use of ineffective antibiotics. Beyond managing the fever, the child's diet is the most significant biological trigger for acute pain during recovery. Returning to the care protocol, the top diet section establishes a strict culinary boundary. All meals must be soft, bland, and easy to swallow, relying on foods like oatmeal, mashed potatoes, or warm liquid broths. Caregivers frequently make a catastrophic error here. Driven by the desire to boost immunity, they offer a glass of orange juice or vitamin C supplements. This diagram explains why citrus is so dangerous. Sour foods are potent triggers, forcing the mouth into excessive saliva production. In a mumps patient, this saliva hits an inflamed, blocked gland. The fluid backs up, creating massive internal pressure and immediate agonizing pain. A strict soft diet functions as an active defense mechanism, protecting the blocked glands from severe physical trauma until the swelling subsides. The final step in the daily routine is a localized physical therapy to manage the visible swelling in the jaw and neck. The pain management panel shows the correct application method. Apply a warm or cold compress directly to the swollen areas for 10 to 15-minute intervals to actively relieve tissue tightness and localized pain. Looking at the home care schedule, you can see how this fits into the broader timeline. This physical therapy is a continuous, repeating action that must be executed every single day of the quarantine period. Combining these targeted compresses with a strictly bland diet creates a comprehensive physical shield against the worst discomfort the virus can cause. Here is the complete recovery protocol. You have 5 days of isolation, weight-based pain medication, a soft diet with absolutely zero citrus, and the daily application of localized compresses. By executing this exact sequence of rules, you suppress the severe symptoms and allow the viral life cycle to burn itself out without triggering unnecessary complications. The result of this discipline is a resting, comfortable child successfully navigating the infection without experiencing agonizing flare-ups. Before beginning any medication, you must consult your pediatrician to confirm the exact weight-based dosages for the paracetamol and ibuprofen. Furthermore, if the child's fever spikes dangerously high despite the medication, or if they refuse to drink any fluids at all, you must bypass this at-home protocol and seek immediate emergency medical care. While the mumps virus must run its course, following these specific steps ensures the next 5 days are predictable, safe, and free from unnecessary pain.